All right, guys, I'm making a lot of training videos today. So in this video, I am going to be both the patient and the provider. I'm the physical therapist, but I'm also going to be the patient. I'm going to create a fictitious case so you can kind of see what it's like without me violating any patient privacy. I'm going to be using HippoScribe and its ambient recording feature to record probably about 10 minutes what it typically sounds like when I'm seeing and interviewing a new patient for the first time. So let me set up the screen share. I want to make sure that I do this correctly. So do me a favor, just bear with me. Let's see here, you guys. I'm going to try and take you in. So here's the typical HippoScribe screen. And I'm gonna do this a little different because I'm recording from both sides. I'm gonna try and say like my name and stuff, which I wouldn't normally say. But hi, so my name is Tony Maritato. I'm your physical therapist today. What are we working on? Hi, my name is John Doe. I am the patient for today's physical therapy evaluation. I'm here because my doctor prescribed physical therapy for right shoulder pain. Hi, John. Good to meet you. I'm going to get a copy of your insurance card and driver's license. In the meantime, let me get a little information. So tell me what's been going on with the shoulder. How did this start? What's it feeling like? Tony, my shoulder has been hurting for about 3 months now. It started just out of nowhere. I woke up one morning. I noticed that I had some shoulder pain. I thought it would get better on its own. It never got better. So a couple weeks later, I went to see my doctor. Okay, John, that makes sense. Have you had any x-rays or MRI or other imaging? Tony, no, I have not had any imaging on my shoulder. They just prescribed some pain medication and muscle relaxers, some anti-inflammatories, and prescribed physical therapy. Okay, John, that's pretty common. Tell me a little bit about your typical daily activities. What do you do? Are you working? Are you retired? Do you play any sports? Or what are some of the things that you do during the day that make the shoulder pain better or make it worse? Okay, Tony, I am retired. I'm 68 years old. I can tell you that I'm unable to sleep on that shoulder because when I lay on that shoulder, it increases my shoulder pain. I can tell you that I haven't been playing golf or pickleball because my right shoulder pain gets worse after I play. There's nothing that really makes it better, but if I don't use it, it doesn't hurt quite as much. Okay, John, that's great information. Have you ever had surgery on the right shoulder or surgery related to the neck or the spine or any other orthopedic surgery in the past? Tony, no, I've never had any orthopedic surgeries at all. I've never had shoulder surgery. Okay, John, does it bother you when you're driving? Does it bother you when you're getting dressed or taking a shower? Are you able to wash your hair using your right hand? Tony, my shoulder pain does hurt when I'm trying to wash my hair using my right hand. I'm right hand dominant. My shoulder pain does bother me when I'm driving, especially if I'm steering with my right hand or trying to reach behind into the back seat. My shoulder pain does cause me to have some problems when I'm trying to put on a t-shirt. But other than that, it's just a nuisance and annoying most of the time. Okay, John, that's great information. Is your shoulder pain getting better, worse, or basically staying the same? Tony, I would have said my shoulder pain was staying the same, but over the last 2 weeks, ever since I saw my doctor, it seems to be getting worse. Okay, great. Well, let's go ahead and start your physical examination, and then we can see what kind of findings we get from that. Okay, so as like the most weird thing I have ever done. I've never tried to be the patient and the therapist at the same time. I promise you, the back and forth is far more natural in real life than you saw in that example. But basically, that gives you an idea of a typical case history, right? We ask the questions. Now, what I would typically do is one of two things. I pause the ambient listening feature because usually this is about when we go into and start doing stuff. Uh, I will usually start to talk about other things. It's not just about the case history. So I might get information about neighbors or family members or friends. And I don't want that to confuse the topic. So I typically stop or pause the recording. Now imagine we came into the clinic, maybe I did a little soft tissue work. Now we're doing the UBE, we're doing some stretches. And at some point in this, I'm going to get some measurements. So now I'm going to begin the recording again. Okay, John, let's go ahead and get some range of motion measurements. I don't need you to push through the pain, but I want to get a sense for where we're starting. So let me get you to reach your right hand straight up overhead. This is going to measure right shoulder flexion. Okay, John, it looks like your active range of motion for right shoulder flexion is about 92 degrees before you start hitting the painful range. I'm going to give you a little bit of help. Let me move the arm. Passive range of motion for right shoulder flexion is now 127. Let's take a look at external rotation for the right shoulder. So go ahead and keep your elbow pinned at your side and bring your hand away from your body. So active external rotation on the right is about 32 degrees before the pain starts to limit range of motion. Now you just relax. Let me go ahead and move it. Okay, passive range of motion for external rotation on the right is 78 degrees. Let's do horizontal abduction, which is reaching across. So your right hand is going to reach your left shoulder. Okay, range of motion, active range of motion for this is about 12 degrees. I'm going to give you a little bit of assistance. Passive range of motion for horizontal shoulder adduction is 27 degrees. All right, John, that's great. Let's do some grip strength. So right hand grip strength with a grip strength dynamometer. Go ahead and squeeze this as hard as you can. The first reading is 72 pounds. Relax. Now let's go ahead and squeeze it a second time as hard as you can. Okay, this time we got 75 pounds. Let's do it one more time. Squeeze as hard as you can. This time we got 73 pounds. So pretty consistent. Let's go ahead and do the same grip strength on the left. First attempt, 68 pounds. Relax. Second attempt, 72 pounds on the left. Relax. Third attempt, 70 pounds on the left. So pretty consistent. You're still stronger on the right for grip strength, but we definitely see some range of motion deficits because of the acute shoulder pain. So like that's a typical, little physical examination. Certainly you guys will check upper quarter screening, you'll check neuro, you'll check reflexes, you'll check all that kind of stuff. You can put all that stuff into the system. Now from this point, what I would typically do is I would look at either ending the recording, and if I needed more content, I would start a new recording for the same patient, or, maybe I would hit like resume and capture more information. I don't want this video to be super long. So what I'm going to do is I'm going to say, let's end the recording session. Let's let this process. Now you guys are seeing this in real time. I'm not pausing anything. That was about 6.5 minutes of total recording time. It's generating the documentation. I am using the United Healthcare template that I've got. So let's see what kind of information we have. What I'm going to do is I'm going to stop the sharing for a second. I'm going to resume the share, but I'm going to turn on the sound. And now you should be able to hear this read.
Patient John Doe reports right shoulder pain persisting for approximately 3 months. Pain onset was unprovoked, beginning suddenly upon waking. Treatment prior to physical therapy included prescribed pain medication, muscle relaxers, and anti-inflammatories. The patient has no history of shoulder, neck, spine, or other orthopedic surgeries.
Okay, pretty good medical history.
Prior to symptom onset, John was actively engaging in activities like golf and pickleball without restriction or discomfort. Currently, shoulder pain limits engagement in these activities, and he experiences pain while driving, dressing, and performing personal care tasks.
Okay.
Right shoulder pain affects patients' ability to sleep on the affected side and participate in recreational activities like golf and pickleball. The pain impacts daily activities such as driving, dressing, putting on a t-shirt, and washing hair due to limited range of motion and increased pain with right shoulder use.
Now you can see it auto-generated a ICD-10 code. You can obviously choose if it doesn't give you the appropriate code. Oh, I didn't mean to do that. Prognosis. It auto-generated a prognosis, but I would obviously use my prognosis.
With consistent physical therapy focusing on increasing range of motion and reducing pain through targeted exercises, John has a reasonable potential for significant improvement in shoulder function and reduction of pain over the next 8 to 12 weeks.
We've got some objective measurements.
Range of motion, right shoulder flexion, active 92 degrees, passive 127 degrees, right shoulder external rotation, active 32 degrees, passive 78 degrees, right shoulder horizontal abduction, active 12 degrees, passive 27 degrees, grip strength, right hand, 72, 75, trials.
Okay. So you see plan of care is blank because I didn't really dictate or determine any kind of plan of care. You can see here that functional or physical impairments, there's not really a whole lot there. Again, I'm not feeding that information into the system, but most of this information is going to come from my pre-formatted templates. I've got this set up to generate some goals, but I'm not typically going to use any of these goals. I'm going to use goals based on the functional outcome measure that my patient had completed. I've recorded a separate video showing you how I use AI to auto-generate current level of function, goal level of function, and prior level of function based on the scores that my patient gives me for the functional outcome measurement tool. A couple little odds and ends, we've got like extra boxes here for unique information if I want it. I don't typically use a lot of this, but I do like to kind of see other options that are here. You guys like here, I prefer this little objective section compared to the objective section you saw here. It's almost exactly the same. It's just a little bit different. I like to experiment. Now here's a self-audit field that I created that shows you what's present and what's missing. So like date of service or date of treatment is there. Specific CPT codes not mentioned. Well, that's because my EMR is going to generate the CPT codes when I put this in. Length of session not specified, that's in my EMR. Individual response to treatment. I'm not using this for a treatment note. I'm using this for my case history and specific elements of the eval, not the complete evaluation. But I love having an internal audit system that, again, you can generate. Okay, I don't want to waste any more of your time. I think you can see we record the initial interview. That recording gets transcribed into a narrative text. That narrative text gets processed by HippoScribe and turned into a formatted chunk of information. It could be the patient case history. It could be the subjective report, whatever, however you want to format it, that information is there. And it's just a baseline. It's just something for you to start with that you could always add narrative to. So the other thing, let me show you this real quick. The other thing that I think is super impactful here is you also have the transcript, so you can see here it recorded, I'm going to get a copy of your insurance card and driver's license. There are elements in this information that even if it didn't show up on the output, we have a record of everything that was discussed, everything was talked about. So here it says, my shoulder pain does cause me to have problems when I'm trying to put on a t-shirt. So like that is an element that I might use in other parts of my documentation. There is a ton of useful content in this. I just think it's an incredible technology. If you guys have questions, comments, concerns, you know how to reach me, post them here. But I will continue to share updates as I continue to use HippoScribe and other technologies to improve the effectiveness of my patient care.